Welcome back, dear viewers, and you are still watching Cairo Local Time. And in this segment of our program, we will talk about efforts done by the government to improve healthcare here in Egypt. And we are joined today by Mr. Dr. Magdy Adly. He is a senior inspector in the Health Insurance Authority. Good afternoon.
Good afternoon. Good afternoon for all our viewers.
So, sir, as I've just mentioned, that the government has done great efforts in improving healthcare here in Egypt in the past years. So, can you shed light on these efforts?
In fact, all of us know that Mr. President, His Excellency Mr. Fattah Sisi, does his best to improve the healthcare for Egyptian people. And even the Ministry of Health do that as well. And to be more accurate and to be talk statistically and numerically, we're supposed to shout out for what have been done. Like 54.5 billion Egyptian pound have was the cost of healthcare in 2020 and 2020 as medicine, as an equipment, as infrastructures, as wages, and like 6 billion Egyptian pound would cost for elimination of waiting list. You know, there even before epidemic or pandemic of COVID, there was a problem for waiting list of surgical operation of many specialties. So all these waiting lists have been done with the cost of 6 billion Egyptian pound. If we are talking about the campaign which have been done, we can talk about 30 million citizens have been investigated through that campaign of chronic disease. Like 12 great Egyptian women have been investigated through the campaign of Egyptian health of Egyptian women health supporting and early diagnosis of breast cancer. Nobody can deny the rule of government and the rule of Mr. President for elimination of hepatitis C. And how the country did its best to eliminate that big medical problem with the certification of many agencies and many authorities. That what happened. And in the last, we can talk about the issue or crisis of COVID-19. And in fact, there is Ministry of Health did a very good job, especially the preventive medical sector in the ministry, which make a very good job through following up the tree of even mixed people of infected people.
Yes.
And covering the supportive activities like what happened on handball championship last week or shot championship in a few next days. They secure the health the system in these activities. Although they are having a job of inspection on food suppliers to secure health and safe food for Egyptians. Yes. That which is clear for for all people, the job of Ministry of Health and what happened, and even we can talk about the big
comprehensive
medical, yes,
healthcare system, yes.
big medical project, which
Yes.
is the comprehensive insurance health system. This one is very important part, because this will be a very nice and very important move on the medical map of Egypt. Because you know, not all Egyptians now are under the umbrella of insurance system, but some of them are under that umbrella and others are out of that umbrella. That system will keep all Egyptians are under the umbrella of health insurance. So they don't need to go to a private clinics or private hospitals. All these clinics and private clinics and private hospitals will be shared in that system, and the individual just paying some what is called seasonal
checkups.
Yes, to be shared under that umbrella, and a small part of when he go to clinics, even he will pay a small part of
part of
money,
the fees, not all the fees.
Yes, or even medicine, like 10% only of the price of medicine.
Already this healthcare insurance system has started to be applied in Port Said, and it proves to be so successful, and now we can see that it will be implemented in other Egyptian cities. I think Ismailia, the president launched it last week, and he also integrated many medical complexes in Ismailia, and he made very important speech during his inauguration. So can you shed light on this?
That's right. Mr. President, in fact, he said that we supposed to hurry up to cover all Egypt, because you know, when they start for that comprehensive insurance system, they planned 15 years to cover all Egypt.
Yes.
But Mr. President said we need to be hurry up to short that period of time from 15 years to 10 years only.
Yes.
And the first stage was, or first phase was in Port Said. Then we come to the second, which is Ismailia, and some governorates in Upper Egypt.
Yes.
Even a citizen in Port Said now, they touch the difference between before that system and after that system. They find it's a very good for them to be under an umbrella, and he not pay a lot of money. This is the idea of comprehensive insurance system. Yes.
Yes, sir. Also, one of the achievements also of the health ministry is the medical centers for vaccinations, which are now found in 40 places here in Egypt, and they are actually responding so quickly to a coronavirus pandemic, responding in many aspects, getting ready by my vaccination centers, and putting lists for those who are supposed to start vaccinations, making registration sites. So how do you evaluate all these efforts?
That's a good question, by the way. From the beginning of when we received the first batch of vaccine, which was the Sinopharm vaccine, the Ministry of Health, in fact, they make a plan for vaccination. through, they make first priorities for vaccinations, as people know that first is the medical team in quarantine hospitals and screen hospitals, then elderly people over 65 years old, then the people who are having a chronic disease like hypertension and diabetics, then at last is the normal people. So there is a priorities for vaccination. The procedure itself, or the way of vaccination, will through a website created by the Ministry of Health. That website, you're supposed to send an SMS for that website, and that website will determine the place or location and the time of vaccination, because not all people will vaccinated in the same time. That website will determine the priorities and the time and the place of vaccination, according to the data you send through SMS. And Ministry of Health create like 40 centers for all over the different governorates for that purpose exactly. And if even an elderly people can't catch that center of vaccination, he can direct go to the nearest hospital to have the vaccine.
So, sir, how do you read international reports about the outcome of vaccination abroad? Is it successful? Now we can see millions of people are vaccinated worldwide. How do you read the reports on vaccinations and the outcome?
Look, for vaccines, all of vaccines now are giving a good result, by the way.
Till
but
now.
the problem up to now, yes, but with a different percentage, like, but all of them from 80% up to 95% as a protection, and like 99 as a creation of antibodies, and some of them 100% preventing the progress of symptoms or severe symptoms. But the problem, in fact, and even Mr. President says that we supposed to talk to the international agency for that issue, to how to the availability of vaccine for all people, for people in Africa, because you know that rich countries would like to take the share of the lion from that vaccines. Yes. So international agency, in fact, supposed to support poor and low-income countries in that issue exact. But about the results of vaccines,
is it promising?
They are a very good promising results. And even for the new variants and new cases of COVID-19, they give good results. But the problem is how to have a vaccine. In fact, the problem is the company of manufacturing vaccine can't
offer more.
Offer more of the purchases, and yes.
But I think Egypt received the new batch this week.
Yes, yesterday before, Ministry of Health have received like 300,000 doses from
big amount of doses.
Yes, from a Republic of China. In a frame of friendship, by the way, and solidarity, and because you know Egypt stand with China in the beginning of the pandemic through sending face masks and medical equipments to China in the first. So they send it as a donation and as a gift for Egyptian people.
So, sir, also if we talk about a third wave, and there are some people who are saying that we should expect a third wave in the coming months, or it's only still we are in the second wave and
No,
it hasn't ended?
We still in the second wave, by the way, and the problem now is a condition of weather.
Yes.
When the weather come heater,
yes,
the number of infected cases will decrease, and the curve will decrease. As you know, that that pandemic is like a cold environment. So when the weather come heater, and the humidity come more humidity, the virus can't spread as
quickly.
a large. Yes, that's right. So I think by the beginning of March or the end of
When
March,
the weather gets warmer.
yes, this will keep the number of infected cases very low, and we can start, as you know, that effect for the income, international income. We can start again, and we can be in a safe, and even when we receive a vaccine, because this is not the last batch of vaccine we will get a lot of vaccine in the next few times, because you know Egypt have what is called a dealing for agreement with international many countries for
yes,
to import or to receive a vaccine.
So can you, sir, tell us more about the Russian vaccine? And they said that it gets accreditation from here in Egypt, I think, and in many places.
Yes. First of all, Russian vaccine have tried in Russia, and a lot of people there take that vaccine, and that vaccine give a good and promised results. And even they found that it can use for elderly people over 65.
It's safer.
Yes, and safer for 60 over.
It's also weakened
yes,
virus.
It's a traditional way of vaccination.
It's the same like the
yes, yes, but it's very effective, by the way, and safe for elderly people over 65 years old, and even for children. That is
Russian vaccine.
yes. Some vaccine, by the way, is not permitted for
elders.
Elderly, no, for children under 16 years old.
Yes.
Like American vaccines, and some under 18 years old is not permitted. But Russian vaccine said that it's yes, safe for children and elderly people.
Yes. So do you expect that we can get it here in Egypt? I think
yes. By the way, Egypt have a good relationship with Russia, and these issues go like in a frame of friendship.
Yes.
When you have a good friendship with any countries having manufacturing
they cooperate together.
Yes, you have the priority for receiving the vaccine.
Yes.
And I think we have that criteria.
Yes. So finally, I'd like to thank you, Dr. Magdy Adly, Senior Manager Inspector in Health Insurance Authority. Thank you, sir, for being with us.
Thank you very much. Thank you.
And by that, dear viewers, we come to the end of today's edition of Cairo Local Time. I'm Sheena Adly. Thank you for watching.